yourself.
Okay. My name is Michael Ostrowski, and I'm a patient here of Dr. James. And I originally started seeing Dr. James as I've been a grappler in martial arts for 35 years, and my body has been through the paces over the years. And as I get older, recovery takes some time, and injuries take longer to heal, and sometimes the longer healing injuries become permanent injuries. So I initially started seeing Dr. James because I had some problems in both shoulders. I had limited flexibility in my shoulders, and that kind of impedes my sports performance as well as my training. So initially I came to Dr. James, and he put me on a treatment plan on stretching my shoulders in various ways a couple times. Well, it would be once a week, but for various lengths of time. And the stretching was working for a while, and then Dr. James introduced me. He kind of put a program up for me to help my shoulders. And one of the first things that we did was he exposed my shoulders to Transgenic treatments. And that really broke up all of the scar tissue in my shoulders. And from what I understand, Transgenics for shoulders is mostly used for frozen shoulders. And if you know anything about frozen shoulders, basically your arm is stuck to your body or stuck in a position, and you can't move it or lift it or have any range of motion. Mine wasn't that extreme, but in certain ranges of motion I would have extreme pain, or I would have weakness, or I just didn't have the flexibility. So part of the program Dr. James put me on was the Transgenics treatment, which was the first step, and that was to loosen up and break up all the scar tissue in the shoulder and really get that range of motion that my body should have. Because years and years of abuse on the shoulders, as well as other parts of my body, kind of limits my range of motion. My body kind of shuts down and only limits me, consciously to certain areas. And if it goes outside of that area, it becomes very painful, or I don't have a lot of the strength. So the part of the program, like I said before, was the Transgenics, which broke up the scar tissue, got the range of motion in my shoulders. And the other two parts of the program for recovery for my shoulders was I did some stem cell treatments on my shoulders. I had injections in both shoulders of stem cells, as well as I had some neurofeedback therapy. So all those three coupled together seemed to work real well for me. I got the range of motion. I'm working to get my strength back in all areas of my new range of motion I found in my shoulders. And the stem cells, when I had those in my shoulders, they were like night and day. Literally after I had the stem cell injections, that evening and the next day, I was basically pain-free. And I did notice that after the Transgenics treatment, which kind of gave me more range of motion, the stem cells that were the treatment that I have would go in there and help repair any of the bad cartilage or bad tissue that prevented my shoulders and to move the range of motion. So, and the neurofeedback therapy retrained my brain so I wouldn't tell my body to shut down and keep my shoulders in a certain range of motion. I would open up my brain, and so I can actually not have it shut down prematurely or not what I wanted to do, or eliminate the pain that the body was so used to seeing at different angles of moving my arms and moving my shoulders. I highly recommend the program that Dr. James put me on, specifically Transgenics, because I spent countless times being stretched and manipulated to try to achieve that range of motion, and the Transgenics treatment was a little bit more aggressive and involved a lot more than just normal stretching, and it really did make a difference as far as opening up my shoulders, opening up any of that scar tissue or anything that impeded my movement of my arms, coupled with the stem cells and the neurofeedback therapy. It really kind of all-encompassing made my shoulders work better together as far as having things that I haven't had in years. As far as movement, I would have a very limited movement. I'm a grappler. I keep my arms in this position. I pick people up. I throw people. But outside of this range, I didn't have a lot of flexibility, a lot of strength, and really limited to a lot of things in the quality of my life and the personal level, as well as it impacted my sports. So I highly recommend, if anybody has shoulder problems, I just had a friend go through shoulder replacement surgery last Friday, and any kind of orthopedic surgery is long and cumbersome. The rehabilitation time it takes a long time. It's a big commitment on your life. I would recommend evaluating this treatment first before any kind of surgical options, as far as stem cells, the Transgenics, and then the neurofeedback, to make sure that the Transgenics and the repair the stem cell does the neurofeedback, reassigns your brain, retrains your brain, so you can have the range of motion that you had before.